Why do doctors do liver function tests? Liver function tests are blood tests used to help diagnose and monitor liver disease or damage. The tests measure the levels of certain enzymes and proteins in your blood produced in your liver. Most diseases start due to damaged liver, and one could assess the damage through liver enzyme studies. The four warning signs of a damaged liver are yellowing of the skin or whites of the eyes, that's called jaundice, swelling in the legs, ankles and feet caused by a buildup of fluid called edema, swelling in your abdomen caused by a buildup of fluid known as ascites, a high temperature and shivering attacks. So, your doctor will request a group of blood tests that provide information about the state of your liver. These tests include prothrombin time, activated partial thromboplastin time, albumin, bilirubin, and others to assess the functions of the liver. How does your doctor suspect liver damage? If signs and symptoms of liver disease do occur, they may include the following: skin and eyes that appear yellowish or jaundice, abdominal pain and swelling, swelling in the legs and ankles, itchy skin, dark urine color, pale stool color, chronic fatigue, nausea or vomiting. The liver function tests typically include alanine transaminase or ALT, aspartate transaminase or AST, alkaline phosphatase or ALP, gamma glutamyl transferase or GGT, serum bilirubin, prothrombin time or PT, the international normalized ratio INR, total protein and albumin. When you get the blood reports on your liver function tests, you need clarification on what those abbreviations stand for. I am now going to explain every test done to check on the health of your liver. Now let's talk about alanine transaminase or ALT. The alanine aminotransferase or ALT test is a blood test that checks for liver damage. An increased ALT level is often a sign of liver disease. An increased ALT level may be due to liver scarring or cirrhosis and death of liver tissue. Liver disease is even more likely when the levels of substances checked by other liver blood tests have also increased. ALT levels greater than 15 times the normal range indicate severe acute liver cell injury, and evaluation should be initiated immediately. The differential diagnosis for patients with severe acute liver injury, ALT levels are 15 times the normal range, is relatively limited. Alanine aminotransferase or ALT is a specific marker for liver inflammation and is typically elevated in individuals with a fatty liver. Average blood test results for typical liver function tests include ALT 7 to 55 units per liter. Now let's talk about alkaline phosphatase. An alkaline phosphatase or ALP test measures the amount of ALP in the blood. It is commonly used to diagnose liver damage or bone disorders. High alkaline phosphatase or ALP levels may indicate that there is damage to your liver or that you have a type of bone disorder. Liver damage creates a different type of ALP than bone disorders do. Alkaline phosphatase is high if the blood levels surpass 130 UL. Elevated alkaline phosphatase doesn't cause any symptoms directly. The symptoms will depend on your underlying health issues such as liver or bone disorders. Now let's talk about the gamma glutamyl transferase or GGT test. It measures the amount of GGT in the blood. GGT is an enzyme found throughout the body. What does it mean if my GGT is high? Having a higher than normal GGT level in your blood may indicate that a condition or disease is damaging your liver. However, the GGT test alone cannot identify the specific cause of the damage. In general, the higher the GGT level, the greater the damage to your liver. Let's now talk about prothrombin time or PT. The prothrombin time, sometimes referred to as PT or pro time, is a test to evaluate blood clotting. The prothrombin time or PT is one way of measuring how long it takes blood to form a clot, and it is measured in seconds such as 13.2 seconds. A typical PT indicates that an average amount of blood clotting protein is available. A typical PT result is 10 to 14 seconds. Higher than that means your blood is taking longer than usual to clot and may be a sign of many conditions including bleeding or clotting disorders, lack of vitamin K. A high PT usually means that there is severe liver damage or cirrhosis. When the PT is high, it takes longer for the blood to clot, 17 seconds for example. This usually happens because the liver is not making the right amount of blood clotting proteins, so the clotting process takes longer. Now let's talk about albumin and total protein in relation to liver disease. The total protein test measures your body's total amount of albumin and globulin. It's used as part of your routine health checkup. It may also be used for unexpected weight loss, fatigue, or kidney or liver disease symptoms. What do high albumin and total protein mean? Albumin is a protein in your blood plasma made in the liver. High albumin levels are usually the result of dehydration or severe diarrhea. Low albumin levels might result from kidney disease, liver disease, inflammation, or infections. Low levels of serum albumin suggest your liver is not functioning correctly. Now let's talk about gamma glutamyl transferase or GGT. What does it mean if my GGT is high? Having a higher than normal GGT level in your blood may indicate that a condition or disease is damaging your liver. However, the GGT test alone cannot identify the specific cause of the damage. In general, the higher the GGT level, the greater the damage to your liver. Now let's talk about L-lactate dehydrogenase or LD. What does it mean when your LD level is high? Higher LDH levels usually mean you have some tissue damage or disease. Disorders that cause high LDH levels include anemia and kidney disease. Let's talk about serum bilirubin test. Bilirubin testing may be done to investigate jaundice, a yellowing of the skin and eyes caused by high albumin, high bilirubin levels. This test is commonly used to measure bilirubin levels in newborns with infant jaundice. What is a high bilirubin level? Typically, bilirubin levels fall between 0.3 to 1 milligram per deciliter. Anything above 1.2 milligrams per deciliter is usually considered elevated. What is the leading cause of high bilirubin? Higher than usual levels of bilirubin may indicate different types of liver or bile duct problems. Sometimes high bilirubin levels may be caused by an increased rate of destruction of a red blood cell. Next time when your doctor requests for blood liver function test, and when you receive the report, you may be able to interpret the situation by being familiar with the liver enzymes. Remember the factors that cause liver damage and take measures to avoid them. There are factors that may increase your risk of liver disorders, including heavy alcohol use, obesity, type 2 diabetes, tattoos or body piercings, injecting drugs, using shared needles, blood transfusions before 1992, exposure to other people's blood and body fluids, unprotected sex. I hope this video presentation has been beneficial. Please stay safe and goodbye and blessings from Candy until we meet again. Thank you.